Do you ever have issues with pain or pins and needles or numbness in this part of your hand or wrist area? Carpal Tunnel Syndrome is a common condition that affects this area. Today we ask hand surgeon Mr Elliot Sorene to tell us a bit more about Carpal Tunnel Syndrome and also treatment options available.
Hello there. So what are the treatment options for carpal tunnel syndrome? So carpal tunnel syndrome is a very common condition which involves compression of the median nerve in the wrist. And it can be on the background of a number of related issues, such as diabetes, inflammatory arthritis, hypothyroidism, and in some cases, treating the underlying condition can solve the problem. Carpal tunnel syndrome is also extremely common in pregnancy and towards the end of pregnancy. Carpal tunnel syndrome primarily, if it's mild, the symptoms will present with pins and needles and numbness affecting the fingers. It could be just the thumb, could be the radial 3 digits, the thumb, the index and the middle finger. It could be all of the fingers of the hand. And occasionally this presents with pins and needles, altered sensation, and waking up at night. And sometimes patients shake their hands or they'll drop their hand low down to relieve the issue. If it's mild carpal tunnel syndrome, it can be managed, physiotherapy, night splintage, nerve gliding exercises, activity modification. However, if symptoms persist, and this is problematic, and it affects the patient's activities of daily living, then we undertake nerve conduction studies to assess how severe the compression is on the nerve. If it's mild compression, this can be sometimes treated with an ultrasound scan to assess the compression of the nerve and a small steroid injection. And this can often solve the problem for a long time. However, if symptoms are severe and if the patient is presenting with weakness in the hand or wasting of the muscles of the thenar eminence at the base of the thumb, then we'll be more inclined, certainly, to undertake surgery. The good news is the surgery for this condition is the most successful operation in orthopedic surgery. It's only a small incision in the hand, which we undertake. A small incision, and this operation can be undertaken under local anaesthetic or under general anaesthetic or under local anaesthesia with sedation. And during the operation, we release the nerve and close the skin with some stitches. And the recovery is relatively fast afterwards. And this certainly can relieve symptoms and solve the problem completely unless there has been irreversible nerve damage. So that's carpal tunnel syndrome for you, a condition which causes a great deal of problems, however, which can be certainly treated very successfully. Thank you.